Do you have a large knot at the backside of your elbow? You could be suffering from something called Olecranon bursitis. Now, what Olecranon bursitis is, this is where the bursa sac, a fluid-filled sac on the backside of the elbow, becomes inflamed, and that can be from different reasons. That can be from an infection, or it can be from maybe you were propped up, on the elbow, or you hit it on something. So different causes, for this to happen. And if you are, a lot of people will ask, what do I need to do about it? So the gold standard with this, a lot of times it may go away on its own. If not, you have to go in the physician, your doctor's office, and they're going to use a needle and aspirate that. They can aspirate it. A lot of times that does a trick. It doesn't come back. But if it does keep coming back, then you're going to need what's called a bursectomy, where they go in and take the bursa sac out, just remove it completely. And that does really well. A lot of times, as far as if you don't have surgery, people ask, will therapy help? Is there something that therapy can do? There's not a lot of good research that supports a lot of therapy techniques prior to having surgery and having this removed, other than things like try to kind of go over different ways to modify your activities or your movements and try to avoid putting pressure on this area to try to take some of that, that irritation away. You also can use like home TENS units or maybe moist heat or things like that, or your therapist can use, some sort of unit, clinic, e-stim unit, things like that they have to try to reduce the pain that you're having in order to make sure you're able to optimize your range of motion in the elbow. But if you do have surgery and you have the bursa sac removed, then you can go in and have therapy and they'll work on range of motion, make sure you restore all the range of motion, restore the strength in the area. It does really nice. Make sure and monitor for the incision site. And so it's not a really extensive, type surgery, and it doesn't require a whole lot after that, maybe even just a few therapy visits just to kind of go over a home program, most especially. So that is Olecranon bursitis, and I hope this video helps.